The people that are running, ministries of health and running health systems and working in government, they know what their countries need. They can identify the needs, they can identify the gaps. So that's my first piece of advice, is just, listen to the experts and hear what they're saying, and partner together. CHAI can often serve as an intermediary on this, to basically understand, what are the needs and where can private philanthropy be helpful. The second thing I would say is, let's combine our resources. So, one private philanthropy, trying to make an impact on the large scale needs that have been presented here today, it's hard to do it on our own. But when we pool our resources together, we have more, we're pooling not just our funding, but we're pooling our brain power, and we can be a bigger force for change. When we can work together and pool our resources, we can be even more useful to governments and towards these national plans. And we can help, fund the needs that have been presented here today, strengthening the training institutions, investing in digital solutions, things like Project Echo that can help, expand remote sharing and learning of in-service providers. And then finally, my biggest piece of advice is, invest in people. I mean, if we have learned anything through this pandemic, it's that health workers are essential. And this can be a key area for private philanthropy to support, to really invest in the champions, from the community health worker whose community is relying on her for healthcare, to the midwife who is understaffed in a maternity unit, to the pediatrician that Dr. Don just spoke about, Dr. Sia, who's the chief medical officer in Liberia. These healthcare champions need our investment and our partnerships. So let's listen to African leaders, let's combine our resources, and let's invest in people.